Referrals. I'm with GAINSWave. I'm here today with Dr. Lamia Gabal, a GAINSWave provider in California. And thank you for joining us, Doctor. First off, if you can kindly tell us about your specialty and your practice.
Yes, so I'm a urologist, board certified in general urology and female pelvic medicine and reconstructive surgery. And I'm the president and founder of Prestige Medical Group in Southern California. We have 4 providers in my office, as well as a large staff, and we treat both men and women for many urological issues, erectile dysfunction being one of them, and sexual health and wellness specifically has been a big focus recently for our practice for both men and women. So we do bioidentical hormone replacement, we do GAINSWave, all kinds of things, O-shot, P-shot, things that have been shown to help for sexual health as well as general urology.
That's great. It sounds like you offer a full range of different health and wellness services. Prestige, is it a hybrid practice where you accept insurance and direct pay, cash pay?
Yes, for sure. So the general urology stuff, of course, we accept insurances. I'm contracted with one HMO. And so we do the general urology stuff on that side. And then we have an elective side as well, where we offer many elective procedures that may or may not be covered by insurance, but are still very important, especially when it comes to sexual health and wellness.
That's great. On the subject of GAINSWave, how did you hear about GAINSWave originally? Do you remember?
Yes, I think many years ago, I remember seeing an article on shockwaves for erectile dysfunction and thinking, wow, this is crazy. That's never going to work. Why would anyone even do that? And then later, hearing colleagues starting to talk about it and how GAINSWave has helped them to have a better understanding for how and why it actually does work. And then hearing testimonials from patients actually when I was researching it online. And then I believe I met someone from GAINSWave at an elective sexual health conference, and I became more interested in getting trained at that point. And then it just has kind of taken off from there once we did the training and signed up with GAINSWave.
That's great. And how long has GAINSWave been part of your practice?
Well, it's been about 2 years now. 2 years. So and it's been a very, very positive part of our practice. Patients are so happy to see that they have another option besides medications or painful injections or things that can actually help to regenerate normal healthy tissue. I like to offer other regenerative therapies in our practice as well. And instead of just treating the disease, actually fixing the disease. I think that was a big reason that I was attracted to GAINSWave.
Thank you. And what features of the GAINSWave program do you find most valuable and important? Is it sales and marketing material, the business support, the patient lead generation? What exactly do you value most as a GAINSWave provider?
So, as a physician, as a provider, I feel like it is very important to have the support that I've gotten from GAINSWave and how proactive that you guys are with all of the marketing and getting us to be involved in Facebook groups and all of the journal clubs and things that you guys are putting on. It really helps us when you take that initiative so that it's easy for me to not only to learn more about it, about the techniques and about the medicine, but also about the marketing. And that part, signing up with GAINSWave and being on the portal, I think has been invaluable because that's where we get most of our referrals. It's not from other urologists, it's from patients who've heard about it. Either they've seen an ad or they've heard it on the radio or something like that, and then they'll look it up and then they'll find us in our neighborhood. So that's been the biggest source of referrals, has been the GAINSWave portal.
That's great. Would you know on average how many patient referrals GAINSWave is sending you?
I would say on average about 4 to 5 referrals per month that we get through the portal. Yeah.
That's great. And on the subject of patients, how have your patients responded to GAINSWave treatment? Good outcomes?
We've had very good outcomes. And, you know, when I'm discussing it with patients, I always tell them there's no guarantees with anything in life. And I say, anyone who guarantees you anything, you should run away from. But, you know, because everyone kind of responds differently. But, but what we've seen essentially for most of our patients is that we can take them back 10 years. So in an older gentleman who maybe has 0% erections, even with medications, you know, I'll tell him that there's a chance that perhaps he'll be able to start using the oral PDE5 inhibitors after 12 treatments, and you would want to go full force with someone like that. For the younger guys who just want maintenance, I mean, so many of them are super happy, not only with their results in terms of erectile function, but also for size and girth. I've had patients come back saying that I didn't expect that, but this is something that really was an added bonus, you know, and just all kinds of happy, good stories from both them and their partners.
That's excellent. Is there a specific patient story that stands out to you?
Well, I know there's a gentleman who came to see us who found us after doing a lot of research online for different providers. He actually felt more comfortable coming to females, and so chose our practice because we do offer female. We do offer. Sorry, you can cut that out. He felt more comfortable having female providers,
Yeah.
and we offer female both physicians and the medical assistants who are doing the procedures. And so he is a nurse practitioner, and he had done a lot of research on this and was just having difficulties maintaining. And after 12 treatments plus the P shot, he is so happy. He's able to have intercourse last longer, more girth. He's telling all his friends. I mean, so this is someone who really had done his homework. And, you know, of course, I was really hoping for a good outcome for him as well, him being in medicine. And yeah, so he's someone who just stands out that I really wanted him to have a good outcome, and he did.
That's amazing. And what would you tell a fellow doctor who's considering adding GAINSWave to their practice?
I mean, honestly, as a urologist, it's a no-brainer. It's something that we should be offering to our patients if we want to be complete in terms of treating their erectile dysfunction. Because again, it's regenerative. It's not just a pill that could have side effects. And it's not for everyone, but there are many men who want this as a treatment. And so not only is it good for the patients as another option for the treatment of erectile dysfunction, but as a business person, and you know, it's something that has added a lot of traffic to my practice and also some income, which is also very nice.
Fantastic. Dr. Gabal, thank you very much.
Thank you for having me.